Site translation number 3. Only a few drops of blood can detect hidden illnesses that are or hidden disorders. What is the HEAL test in newborns? The HEAL test in newborns is a special analysis for newborns. With only a few drops of blood from the heel of the baby that they place on a special paper and is sent to the Wisconsin State Lab of Hygiene to be analyzed. This test, the HEAL test in the newborns, will determine if the baby can develop a hidden disorder that will need quick treatment. What are these hidden disorders? The hidden disorders are health problems whose discovery is difficult or almost impossible for you or the pediatrician to find with only looking at the baby. If you don't treat them, these illnesses can lead to growth problems or slow development, very bad illness, or brain damage, or possibly death. The quick treatment or early treatment can help prevent some of these grave health problems from occurring. Why is it so important to do this HEAL test in newborns? The HEAL test in newborns can save the lives of the babies and can help them to begin to live a healthy life. When these quizzes reveal a disorder, the baby can receive treatment immediately to prevent health problems or even death. The affected babies can appear or look normal at birth. If you at least do a HEAL test, or unless you do the HEAL test, the disease can remain hidden and cause permanent damage to the baby. In Wisconsin, the quizzes, the HEAL test in newborns are obligatory by the law, and to protect the health of the babies. All babies should be examined within the first 24 to 48 hours after birth. Can I say no to the test? It is important for the health of your baby that he or she is examined to see if grave illnesses are present. As a father, you can say no to the quiz only if your religious practices or beliefs or personal convictions don't agree with them. Is the quiz safe? Or the test safe? The test is safe and simple. Some babies cry when they pinch the heel. It bothers them for a moment. There is a risk of infection that's pretty small when they pinch the heel, but it's low. How will I know the result of the quiz? Your pediatrician will receive an information, or basically a sheet with the results. You should ask regarding these results when you bring your baby to the routine checkup. What happens if the result of the quiz is abnormal? If the result of the quiz is abnormal, they will communicate with you some days after they have given the test, and if the result of the quiz is abnormal, your doctor will talk with you regarding or around the next steps to take. An abnormal result of the quiz doesn't necessarily mean that your baby has a disease or a disorder. This quiz finds babies. This quiz also finds that some babies could have a risk of having a disorder. They should also do other quizzes to determine exactly if the baby has a disorder and needs treatment. Why is it necessary to do new quizzes or do like other tests to some babies? There are two main reasons why you might have to repeat the quiz: if there was a problem in the form in which they collected the blood, or if the result of the quiz was abnormal. To repeat the HEAL quiz on a newborn, they should take a new blood sample. The quiz is more precise if it shows the blood, or if the blood sample is taken in the first 24 hours of life. If the blood of your baby is collected before 24 hours of life, the doctor can ask them to repeat the quiz when the baby is 1 or 2 weeks old. How can I help my child? Make sure that you do the quiz before you go to the hospital or before you leave the hospital. Give your email, telephone address to the hospital when your baby is born and give it to your pediatrician. If you don't have a telephone, you can leave the number of a friend or a relative that they can reach. If your pediatrician asks you to return with your baby so that they can do another quiz or for other studies, do it as soon as possible. It's important that the studies and the quiz are done immediately.